This video is all about the best possible medication history, an important part of medication reconciliation. Please note, in this video, patient includes clients and residents of our organization. Caregiver includes family members, substitute decision makers, and essential care partners.
What is a BPMH?
BPMH stands for Best Possible Medication History, a key part of medication reconciliation, also known as MedRec. MedRec is a formal process where healthcare providers work with patients, family members, and other care providers to make sure that the patient's medication information is communicated consistently and accurately as the patient moves through the healthcare system. It involves getting a complete picture of how someone is taking their medications, what is being prescribed to them, and how any changes may impact their treatment and care. MedRec is a vital part of medication management and helps the care team make the best decisions when it comes to the patient's medications.
Why do we use them?
Providing care to patients and clients can involve adding or reducing the number of medications that may impact what they're taking. This requires effective communication between staff members, both inside and outside our organization, as the patient moves through the healthcare system. When a patient is admitted or discharged, or moves to a different unit, facility, or part of the healthcare system, this is called a transition of care. We need clear, effective ways of sharing up-to-date information about what medications a patient is taking and how they are taking them at every transition of care. This is where a BPMH comes in. It's the right thing to do. Wouldn't you want your care team to know exactly what medications you are taking so that they can provide you with safe care? It's a best practice initiative for patient safety, designed to keep patients and clients safe while receiving care. In fact, it's so important for the safety of our patients and clients, Accreditation Canada has made MedRec a required organizational practice, or ROP. We must do MedRec as part of our accreditation. MedRec is also required as per Nova Scotia Health's Medication Reconciliation Policy, number MMSR030.
Where are they used?
The BPMH is used throughout Nova Scotia Health during each transition of care, such as a patient or client's first appointment or assessment, as well as each transfer and discharge where appropriate. You'll find them being used in inpatient units, ambulatory clinics, and other locations in the community.
Who creates them?
Creating and using a BPMH requires an interprofessional, team-based approach to be successful. As per the Nova Scotia Health Policy, MedRec can be completed by any healthcare staff or student whose role involves medication management. This includes registered nurses, nurse practitioners, licensed practical nurses, physicians, pharmacists, pharmacy practice assistants, and more.
How do you make a BPMH?
Creating a BPMH is the first step in the MedRec process. Following this, the next steps are to reconcile the ordered medications against the BPMH, and finally, to document and communicate any changes in medication orders. This video will mainly focus on the first step, creating a BPMH. Making a history of a patient's medications is not new. Healthcare providers have always tried to figure out what medications their patients are taking by asking them questions about their medications and how they take them, also known as a medication history. While this can help the provider make sure the patient is on the right medications, it may not be as thorough as possible. The Best Possible Medication History, or BPMH, is much more formal than a standard medication history, and it's the foundation of MedRec. Creating a BPMH involves gathering a patient's medication information, then interviewing the patient or caregiver to make sure that this information is correct. This relies on the care team accessing complete, accurate, and up-to-date information. The BPMH includes prescribed and non-prescribed medications, and lists the medication's name, dosage, frequency, route, and the last time it was taken. It's done at admission or intake and travels with the patient throughout their stay at all transition of care until they are discharged. To create a BPMH, you first need to gather the patient's medication information. There are many sources to get this information from, and some may be more useful than others. Examples include the medication bottles and lists brought in by the patient or caregiver, medication reports from the Drug Information System, or DIS, or their community pharmacy, blister packs, previous health records. The patient's medical condition can also tell the provider if the patient is on the correct medication. Medication administration records, or MARs, brought in with the patient from other facilities. or medication lists provided by the patient's primary healthcare provider. Unfortunately, there's not one perfect source of this information. When creating a BPMH, you must use at least 2 independent sources to make sure the list is accurate and complete. One of these sources must be the patient and/or the caregiver, as they can provide the most reliable information about how and when the medications are being taken. There may be times when a patient or caregiver is unable to provide this information, such as pediatric patients, or patients who are comatose, delirious, or unable to remember this information. In these cases, you must use as many additional sources as possible, notifying the prescribing healthcare provider that the actual medication use could not be verified. This should also be documented in the patient's health record. Please note, consider the limitations and benefits of each source that you use. For example, some medications are not documented in the drug information system, such as hospital medications, physician samples, or medications related to studies, chemotherapy, or transplants. Also, blister packs may not be up to date or list all of the patient's medications like inhalers and patches. Once you've gathered as much information as you can, it's time to make sure that it's correct by interviewing the patient and/or the caregiver. Begin by introducing yourself and your role on the team.
Hello, my name is Mike. I'm a registered nurse on your care team.
Let them know the purpose of this discussion.
I'd like to ask you some questions to help me make a full list of your medications and how you take them. This will help the care team keep you safe during your stay with us.
Now, it's time to ask some questions about the patient and their medications. The questions you ask may differ depending on the form you're using to document in the health record or in the drug information system. Please note, the MedRec form used to document the BPMH may go by different names, such as Admission MedRec form, Medication History form, BPMH form, and so on. Here are some general questions that most providers ask about the patient. The patient's height and weight. These are important when figuring out the right dose based on the patient's size. The name of the patient's retail pharmacy. Make sure to ask them if they access more than one pharmacy. If so, document this on the form. Any allergies the patient may have. Document all allergies and reactions on the form, including reactions to any dyes or treatments. And also, the patient's immunization status, including COVID and flu vaccinations. Now, it's time to ask some questions about the patient's prescription medications. Here are some commonly asked questions. What is the name, dose, route, frequency, and time of last dose of all their current prescription medications? Some patients may only mention the medications in pill form, so be sure to ask about other forms, including inhalers, patches, creams, injectables, sprays, and drops. Are the pills in the bottle the same as on the label? Sometimes patients may store multiple medications in the same bottle. Is the patient taking these medications as prescribed, including the frequency and dose? If not, ask them how they are taking them. When are these medications being taken, such as the time of day, as needed, and so on? Some patients may forget about less frequent medications, like a monthly B12 shot. Have they stopped taking any of these medications? If so, why? Have they changed their daily routine to accommodate their medications? Finally, ask about non-prescription medications. Are they taking any over-the-counter medications on a regular basis? Examples may include stool softeners, ASA, medicated creams, or medications for colds, sleep, or pain. Are they taking any medications given to them by their doctor or other care provider, such as samples or drugs related to studies, transplants, or chemotherapy? Are they taking any medications that are not prescribed to them, such as someone else's medication? Are they taking any herbal, traditional, or natural products? Examples may include vitamins, turmeric capsules, calcium chewable tablets, and so on. Are they taking any other substances, such as cannabis or alcohol? Once you are finished creating the BPMH, make sure to follow the correct steps in filling out the form, which should be signed and dated by the healthcare provider who created it. This form can then be used as the patient's admission orders once completed. Now that the BPMH is completed, the next step is to reconcile medications. Review the BPMH and the written admission orders to identify and resolve any discrepancies or differences with the prescribing healthcare provider. The final step in MedRec is to document and communicate any changes in medication orders to the appropriate prescriber and the members of the healthcare team. The BPMH may change over time as the patient remembers more information, so make sure to communicate any changes with the care team, including the prescribing healthcare provider. Here are some tips. Don't skip the interview. It takes time, but it's worth it to verify that the information is accurate. When interviewing the patient or caregiver, try not to use medical jargon such as complex medical names, slang terms, or abbreviation. Use open-ended, non-biased questions, such as, "Tell me how you take this medication." Vague responses could mean that the patient is not taking the medication as prescribed. Remember, it's called the best possible medication history. It will never be perfect, so the goal is to make the most accurate and complete medication history that you can. For more information, check out ISMP Canada's Top 10 Practical Tips for MedRec at www.patientsafetyinstitute.ca.
What if I have a question?
That was a lot of information. For full details on the MedRec process, check out the following resources. You can read about MedRec in the Nova Scotia Health MedRec Policy, number MMSR030. You can also take the MedRec tutorial on LMS. And finally, check out Library Services website for the MedRec resources listed there. If you have questions about MedRec or the BPMH, ask a member of the healthcare team